These kind of yellow-brown cells that make up most of the tissue, again, are the excrement cells that for the most part produce digestive enzymes. And they're carried by pancreatic ducts to the small intestine. And there are two major ducts. One that basically runs the length of the pancreas, what's that called? The main pancreatic duct. It's got a fancy name, but it's like the main pancreatic duct. And there's a little bit kind of branches off. What's that one called? It's an accessory pancreatic duct. And those happen to be on the exam. Anyway, pancreatic ducts carry the secretions from these cells. These are excrement cells, also called excrement histidine. And for the most part, they produce digestive enzymes which work in the small intestine. But these, see a different stain on them now, these are the islets of Langerhans for pancreatitis. This is the hormonal tissue. Remember I told you two hormones, actually there are four. We'll look at it now today. The cells stain different. I'd like you to recognize them and know what hormone they produce. The major cell type in the pancreatic islets, same kind of a rose pink that you see here. They're the most abundant. These are beta cells. And beta cells, you may remember, produce insulin. What does insulin do? Lowers glucose levels of blood. Stimulates cells to take up glucose and stockpile it in the cell as glycogen. So it's lowering blood glucose levels. That's the major cell type. Second most abundant are these dark brown cells. Again, we're looking at the cytoplasm. The dark brown cells are called alpha cells. You may remember they produce glucagon. And glucagon, remember, elevates glucose levels. Through those two hormones, most people can regulate their blood sugar levels. Insulin to lower glucose levels, glucagon to elevate. Glucagon stimulates the breakdown of glycogen and releases glucose in the blood. And actually, we've got two other cell types in the tooth. One of which I'll expect you to pick up. They're not as common as the other two. They have kind of a tan cytoplasm. And these cells are called delta cells. Delta cells produce what's called somatostatin. If you look, I mentioned this before, but they're also produced by the enteroendocrine cells based on gastric glands. If you look bottom of page 2, your hormone handout, again, the pancreatic hormones, glucagon, insulin, and then somatostatin on the delta cells. Notice it's got another name. It's also called growth hormone inhibiting hormone, because it inhibits secretion of growth hormone. Also inhibits secretion of TSH, thyroid stimulating hormone. Inhibits release of stomach hormones like gastrin and enzymes from the stomach. Also enzymes of the pancreas, such as glucagon and insulin. Inhibits contraction of gallbladder, release of bile, absorption of nutrients. So basically it shuts things down. Soma means body, statin means to hold, or stop, or hold in check. So this is somatostatin produced by these tan colored cytoplasm cells in pancreatic islets. Right up here. Yeah, you can see this kind of in the microscope. Up there, right. Right here, as opposed to dark brown stained cytoplasm cells, which are the alpha cells. The fourth cell type I always expect you to pick out, they're few and far between. Those are called F cells. They produce what's called pancreatic polypeptide. That's right at the bottom of the page. You can see it inhibits secretion of somatostatin. It basically shuts down somatostatin, which is good. And somatostatin shuts down just about everything else, but you got to have a way to turn it off. And that's what pancreatic polypeptide does. Produced by F cells in the pancreatic islets. Again, you don't have to pick those up, just know they're there and what they do. Okay, so four hormones. Beta cells, these rose pink cells, produce insulin. Next most abundant, the dark brown cytoplasm cells, alpha cells produce glucagon. Third most abundant, the tan cytoplasm cells, delta cells produce somatostatin. And then the F cells, you want to pick out, produce pancreatic polypeptide. Okay? So know those four hormones, the cells are producing,